Today is Monday the 23rd of the 11th 2015. Here in this video I'm going to show you how to register some information on your diabetes patients for the new diabetes cycle of care system. In order for this system to work in HealthOne, you have to have version 8 of HealthOne. Now this hasn't been distributed yet, but will be in the next few weeks. So you must have version 8, and you can check your version by clicking on Help About. And you'll see your version of HealthOne. So a diabetes patient walks in the door and you do a new consultation on him, and you decide that this should be recorded as a cycle of care to be registered with the PCRS. So you click on your Mediforms button here. Very often people click on the little arrow here, and for the moment the diabetes Mediform may not be in that list. So you should click on the red cross sign here to get all of your Mediforms. Type in diabetes and you'll see you have 3 Mediforms here. The one to use if you are involved with the cycle of care, that is if this patient has a medical card and has type 2 diabetes and this consultation is related to the cycle of care, you should choose that one. Click OK, and if the patient has not been registered in HealthOne as being part of the cycle of care, you will get this message which you click yes to register him now, and then you register him online. This has been the subject of another video, so I'm going to tell HealthOne that he has been registered on the 14th of the 9th, and I'm going to click OK. In that case I get my Mediform up for clinical information. And just so that I don't confuse you too much, I should say that the registration in HealthOne has been done previously by putting this cycle of care in and diabetes mellitus as the content and the date of the diagnosis. This has been the subject of a previous video. So if the patient has been registered and now walks in the door for his diabetes check, I click on the Mediform icon again, type in diabetes and double click, and I won't get anything except directly the clinical information. So this is really what you want in the end of the day. So here we have the information that we are required to enter for the cycle of care. I'll now go through this Mediform so you understand what we're doing. So this is the first visit, and it's indicated up here. There will be 2 annual visits, so if you do another Mediform within the year after this, it will be the 2nd visit. Here you know that the date of online registration was the 14th of the 9th as determined previously in your cycle of care item in the administrative file. Today is the date of your visit. So there are several things that you need to record. First of all, you review your results, and this will take all your recent results, and we've added a few extras so that they will be useful to you, including the creatinine clearance and the EGFR. The normal results are here, and the expected result would be here, less than 53 for the HbA1c, and this person's was 64, so we have it in red. So in fact all these parameters here are outside the expected range in this particular patient. If I wanted to see other past results for these parameters, I can click on this button over here, and it will give me a grid view of all of the relevant parameters. And these are the latest 4 consultations, but I can go back by dragging this bar over here and I'll see all his results. So I can view all his results while I'm in the Mediform. The next thing is to review his lifestyle, so you tick the buttons that are relevant: smoking, alcohol, exercise, weight. I have advised him on all of these, and if issues with one or more of these lifestyles, was brief intervention offered, and the answer is yes. You can see here that you can open and close these to get more information, but I'll go through them in a minute. What you're seeing here is the minimum that is required by the PCRS for the data return. Did you review his medication? You can click on a list of his medications. You can review it, close it, and they are reviewed today. Drag the bar down here and you get to the next ones, the height, weight and BMI. We put in here his last weight, his last height and his last BMI. This was done on the 8th to the 10th, but you will be expected to put in the weight today. But we left the 99.5, so you'd see what his last weight was. Let's say it's 100 kilos. You can see it's in black now, which means it's been entered today. No need to change his height because that didn't change. The same if we tab down to his blood pressure. You can see that his last blood pressure was that, so we'll say his next blood pressure is 116/78. Again, with the two of these, heights, weights and the blood pressure, you have a grid analysis of the relevant things that you can look back over all his previous blood pressures and his heights and weights. Immunization status, a review of the immunization status. Influenza pneumococcal. Health One will look through his file and see if he has had either of these. In fact, he hasn't had any, so we'll say reviewed it, but we must put in a plan of action to actually do it. Did we provide HSE patient education literature? Not yet, because we don't have any. And the next review, the second visit. Now this is important, and it has to be at least 4 months from the first visit. So we put in a default here, you can put in whatever you like. And that's the end of the minimum amount of data. So now you have whatever is in here will be exported by Health One when you do an export after a year. If you reopen this to have another look, I should show you that there are other interesting things beyond the minimum amount of data that we are required to send. One is a little calculator here for your chronic kidney disease based on the patient's creatinine, which brings up an existing Mediform in Health One, which allows you to put in, allows you to record his ACR and his EGFR ACR ratio. Also, for each of these factors here, we have a little down arrow here which allows you to expand the list of questions you want to ask to be consistent with our existing Diabetes Review 17 Mediform. So we have everything available to you. Good adherence to his diet, 30 minutes, and his smoking is 12 a day, and his alcohol is 12 a day as well. So you have all of these extra pieces of information, including the subjective symptoms here, which isn't part of the minimum data set, and you can ask him his questions here and put some text in here. You can, below at the bottom, expand everything so that all the extra information is available to you, and you get, for example, provision of symptomatic foot review beyond the bare minimum. You can see you can actually record his pulses, and you can do his monofilaments, and you can do various foot risk categories, and it will tell you what he's doing. The point we're making here is that you can actually use this Mediform for a very comprehensive diabetic review if you wish, but only the minimum data set as displayed when all of these are collapsed will be sent to the PCRS. So we'll say foot review was made, he's attending the retinal screening, and he's not attending the ophthalmologist. We'll reduce that. We'll collapse all except the bare minimum. And we have everything else here. So we now say OK, and we have a minimalistic or a very comprehensive diabetes review done in Health One. It should be noted that the next time you see this patient and you do a new consultation, I know this is the same date, which would be a bit unusual, and you call your diabetes cycle of care, Health One will know that you've already done a first visit, so it will now consider this to be your second visit. And in a year's time it will go back to your first visit and second visit per annum. So if you want to do a diabetes visit and record some diabetes information that is not part of the cycle of care. In other words, it's not your first or your second visit, it might be your third or fourth or fifth visit that you do not wish to be part of the cycle of care. You would in fact use what we have provided is the diabetes review Mediform, which is exactly the same Mediform, but it's not going to be taken into account in terms of the diabetes care. So it just allows you to use the same Mediform, more or less, for extra visits during the year. So in summary, what we have recorded here, what we have displayed here, is how to record in HealthOne a diabetes review for the diabetes cycle of care. And I repeat, because it's really important, that in order to be able to do a diabetes review, you have to have the patient registered in HealthOne as having been registered online. So if HealthOne sees cycle of care diabetes mellitus, it will assume that the patient has been registered online. And we show you this in another video, how to register the patient online and in HealthOne in a very easy way. That's the end of this recording. Thank you very much.